Siddhart Yadav, Orthopaedic and Joint Replacement Surgeon at Apollo Hospital, Navi, Mumbai. Today we are going to talk on an important topic, that is heel pain. And heel pain bothers you most of the people day-to-day life. We see a lot of patients with heel pain, and I'm going to tell you some important information about heel pain and also about the treatment part. Most commonly, patient they complain whenever they get up from the bed in the morning. There is a severe pain on stepping on the foot, and also during the daytime whenever they do any activities or they walk barefoot, they get a lot of pain. Now, the common cause of heel pain is, before that you should understand little bit of structure about the heel. So in our heel, there is a hard tissue. We call it plantar fascia, and that is attached to the heel bone, to our toe bones. And this is plantar fascia. It acts as a shock absorber. It's a very thick fascia. So as you see in the slide, it is attached to our heel bone and then to the toes. It's like a bowstring. So it is important. When we walk, it takes weight, as it acts as a shock absorber. It protects our muscles. So, and there's a lot of wear and tear happens during our daily activities. So main cause of this heel pain is plantar fasciitis, means inflammation, or in common terms we call swelling of this plantar fascia or the hard tissue. So there could be various causes which can give rise to plantar fasciitis or pain. Pain is mostly 50% in the heel, but it can happen in the foot area also. So in plantar fasciitis, common causes, number one common cause is overweight. When you are overweight, you put more weight on your both feet, and there is more pressure on the plantar fascia, which is like a bowstring. So there are more chances of getting it overstressed. So overweight is number one cause. Next cause is overuse. When you do prolonged standing, if you are working in office or your job is of mostly standing, then also we call it overuse syndrome. And in English it's called policeman's heel. So there is a lot of stress on the plantar fascia due to long standing. You are not changing your posture. And there is also sometimes there's a weakness of the muscles of the foot. So muscle of the foot is not able to maintain the arch of the foot, and there is abnormal pressure on the stretching of this fascia or tissue that causes pain. Also, sometimes your shoes are very old, worn out shoes we call it, and the structure of the shoe or the base of the shoes become very hard, and that also gives abnormal stresses to the plantar fascia and give rise to pain. And also some people they do not wear any footwear inside house, and some people do running on the hard surface like concrete surface. That also give rise to stress on this tissue and also pain. Less common pain also happen in some people who have flat feet or their arch is more than normal. Some people have tight tendo-Achilles, the calf muscle. They also can get this pain. Heel spur, many people they come to us, they got a heel spur, that's why there is a pain. That is not true. Heel spur is responsible only less than 5% of the heel pain. It is not very common. Also rarely we get, when after examination we come to know the cause is nerve entrapment in the heel, and sometimes there is some kind of arthritis also, they give rise to heel pain, especially the bamboo spine arthritis. And sometimes there is a lot of vitamin deficiency, bones become weak, we call osteomalacia, and we get small fracture in the heel. That also can give rise to heel pain. But these are less common. Now the treatment is number one is, if you are overweight, you have to reduce weight. There is no shortcut for it. And the treatment also is not only medicine, but it's a holistic approach. We have to do a lot of things. Otherwise, it takes a lot of time also for healing. Sometimes it takes 3 months, it can extend up to 6 months. But if you follow, as I advise, multiple things you can do, then I'm sure it will be cured as early as possible. So number one is start reducing weight. Number two, frequent change of posture. If your job is standing, then preferably after 1 hour or so you should sit down and you should do stretching of your foot. Stretching exercises are very helpful. Stretching like you support the table and try to stand on your toes and go down. So that's called plantar stretching. Not full weight on your toes, but partial weight. These stretching they are very helpful, and you should do at least 3 times in a do. 3 times in a day, 20 repetition. Also rolling. Take a small roller like a 1 inch wooden roller or a small water bottle and try to roll it by your heel. That's called rolling. That also you should do also twice. This rolling and stretching one should do with the before they get up, before they start walking. Like in the morning, you should first step you get up and do stretching, rolling, and then you start walking. Also, if you have pain, then you should not walk without any footwear at home also and outside also. Avoid barefoot walking. Now, if you are doing regular walking, running, then you have to change frequently your sports shoes. The sports shoes, they are scientifically designed. They have a arch. When you run, they support your arch. So if your shoe is worn out, say after 6 months or 1 year, then probably you have to change your shoes. Also, sometime if you are getting frequently heel pain, and then we advise you to get customized heel insole or the foot insole. That is customized is made by a special technique where we make you stand on a computer screen, and then your footprint they are taken, and then according to your shape of the foot, that customized insole is made. That is also helpful. In regularly, if your foot shape is normal, then we advise you a regular insole called valgus pad with C and D heel. That is available in many medical shops. Valgus pad with C and D heel. That is also helpful. Apart from this, if you are not able to get this, wearing sports shoes for a period of time, say 1 month, that will also help. So these things, everything you have to do: stretching, footwear, insole, exercise, weight reduction, and we also give you short course of medication like anti-inflammatory drugs for 8 days, and sometimes we advise you physiotherapy, local ultrasound for 10 days. If you are not getting better, then next step is we advise you, which we have in our Apollo hospital, that is extracorporeal shockwave therapy. There's a special machine which gives shockwave to your heel, that point where, so that 2 sittings sometime helpful. That is only available here. And if you're not getting better after this, the next step is sometimes your diabetes is not there, we give a local steroid injection, and that most of the time you get cure out of it. Some people, they're not getting better after this, then we have next therapy that is called PRP, platelet rich plasma injection. We take out your own blood around 10 ml, we take out plasma out of it, platelet rich plasma, and insert that, and that helps in healing. So 99% by this your heel pain can be cured. Surgery in the heel pain is 99.9% is not required. If you do all this, your heel pain can be cured. Thank you.